So we are really, really fortunate, and I must request all the delegates to clap for the faculty. That famous faculty is visiting Bathinda, and that is because of increasing number of delegates as well as increasing reputation of Mapicon as an academic forum. So I invite Dr. Randeep Gularia to talk about air pollution and health.
Good afternoon, and thank you very much. I'd like to thank Dr. Gupta for inviting me over to Bathinda. This is my first visit to Bathinda, if I put it that way, and I'd like to congratulate him for Mapicon. I'll be talking on air pollution and health, and to some extent it would be a continuation of what Dr. Wander said in his previous talk in terms of the burden of disease. So if we look at what has happened in the last 20-30 years, over the last century our environment has changed as never before. Rapid and unplanned industrialization, especially in developing countries, has altered our environment in a negative manner. And this is now being recognized to be associated with a large number of chronic and infectious diseases. This is a paper in which a lot of us were involved in trying to collate data, and this is very nicely tabled as the nations within the nation, looking at the epidemiological transition that has occurred in India from 1990 to 2016. If you look at the map of India in 1990, and you were to look at non-communicable diseases versus what is known as the CMNNDs, that is communicable, maternal, neonatal and nutritional diseases, you will find that in 1990 the red suggests more of the CMNNDs and the blue suggests more of the non-communicable diseases. In 1990, except for Kerala, which had already started moving towards NCDs, most of India, especially the Indo-Gangetic belt or the central part of India, the bulk of burden of disease was actually related to communicable diseases, maternal, neonatal and nutritional diseases. But this dramatically changed in 2016, where the burden of disease has shifted more and more to non-communicable diseases. Still not that much in central India, but in areas like Himachal Pradesh, Punjab and in Tamil Nadu and Kerala, the majority of diseases now is actually non-communicable diseases, and this happened somewhere in around 2003 that 50% or more of the burden of disease became NCDs. So in 1990, almost 60% of diseases were communicable, maternal, neonatal and nutritional diseases, and in 2016 this shifted to about 55% of diseases actually being non-communicable diseases. What are the main causes or the individuals which cause what is known as disability-adjusted life years? Ischemic heart disease, COPD, diarrhea, lower respiratory tract infections and cerebrovascular disease. But the leading risk factors are malnutrition, air pollution, dietary risk, high systolic blood pressure and fasting plasma blood glucose. Air pollution is right there on the top as one of the major factors which is associated with disability-adjusted life years lost. And it's a silent killer, and we really don't give much attention to it. If you start looking at the annual population weighted mean of PM 2.5 in India in 2017, and this is basically published in the Lancet Public Health this year, the Indian mean is much higher, that is almost 90 micrograms per meter cube as compared to what is usually acceptable, less than 40. Delhi has the highest, followed by Uttar Pradesh, Bihar and Haryana. And we still have a large number of population which actually uses solid fuel for cooking. So again, if you start looking at the map of India on the left, the bulk of diseases bulk of the PM 2.5 exposure lies in what is known as the Indo-Gangetic belt in Rajasthan, Uttar Pradesh, Bihar and Orissa. If you look at indoor air pollution, it's the same areas, central India, where you have this huge burden of disease as far as indoor air pollution is concerned. This is a paper published in Lancet Public Planet Health this year. Again, we tried to look at the impact of air pollution on death, disease burden and life expectancy across states of India in 2017, and we estimated that almost 1.24 million deaths, that is almost 12.5% of total deaths in India in 2017, were attributable to air pollution. 0.67 million from ambient particulate matter and 0.48 million from household air pollution. So both indoor and outdoor air pollution actually cause a significant mortality as far as India is concerned. So what is pollution? It's introduction of a contaminant into the environment. We have land pollution, which again a major problem. It could be littering, it could be sewage, it could be nuclear and chemical waste. Another important issue which is coming is e-waste, which is related to a lot of electronics that we use, and there is not proper disposal of this. We have pesticides, and then we have air pollution and water pollution. And air pollution is basically contamination of the air by noxious gases and minute particles of solid and liquid particles in concentration that endanger health. And an air pollutant is any solid, liquid or gaseous substance present in the atmosphere in such concentration as may be or tends to be injurious to human beings or other living creatures or plants or property or environment. So very broad definition as what is an air pollutant. If we look at the data from the last few years, Delhi actually has this whole issue in the winter months that it's a deadly city. We have a huge number of patients who die, and there is data from various hospitals. This is data from our own clinic where there's a huge spurt in cases with respiratory diseases during the winter months directly linked to air pollution. This is also seen in various other hospitals, private hospitals, and also in other hospitals, that there's a huge spike of cardiovascular and respiratory diseases, especially patients coming to the emergency when there is a higher levels of air pollution. This is something that we see when there is smog, and this is the air quality index. It shows 999, not because the air quality index is 999, but because the meter couldn't go above that. The air quality index at this point in time is sometimes usually 1500 or so. The meters to measure air quality index were not they did not think that they would ever cross 1000, and therefore they were never meant to go beyond this range. But in various parts of the country in Delhi, during the winter months, AQI actually crosses 1000 and it goes beyond the scale as far as the meter is concerned. So we are actually living or having exposure to air quality which is actually not at a high level but at a toxic level, and that is why it's something that we need to be concerned about. This is India Gate, which is before Diwali, and this is how India Gate looks after Diwali, showing you the degree of pollution that we tend to see. On an average, an adult consumes around 3,000 gallons of polluted air every day. Vehicular exhaust contributes to 60% of carbon monoxide emission in the US. And in 1952, the Great Smog, which was one of the worst air pollution incidents in history, in just 6 days, 4,000 people died just because of high levels of air pollution. And in the Harvard School of Public Health estimated that even in the US, approximately 4% of all deaths can be attributed to air pollution. This is how London looked like in 1992 during the Great Smog in 1952, and this is what happened at that point in time, that in these few days there was a huge spurt as far as sulfur dioxide and smoke in the environment is concerned, and this led to this huge increase in death which occurred in this small span in the month of December in 1952. If you look at the pictures from central India nowadays, they resemble this very much. This is just outside our hospital. During the days when we have smog, you can hardly make out India Gate on the top or the Ames flyover at the bottom. And if you look at what the picture was in 1952, it is quite similar, and yet we seem to be less concerned about it. And this is not only in Delhi. If you look at various other cities, Kanpur, Patna, Muzaffarpur, Varanasi, all of them have very, very high levels of air pollution. And that is why it is actually said that 13 of the top 20 cities in the world with the highest annual level of PM 2.5 are now in India. We have cities from Punjab also, Amritsar and Ludhiana are there, and there are various other cities also. So this is not a phenomenon only in Delhi, because Delhi is a central part of India. It's where news happens. It's more in focus. But if you start looking at air quality index in large parts of North India and the Indo-Gangetic belt, you will see very, very high levels of air pollution, especially during the winter months. The other thing that we need to keep in mind, and I'll just spend a little bit of time on this, is solid fuel use. We still have a large number of our population, especially in rural India, which use solid fuel, which could be using wood, cow dung or coal as a means of cooking. In 1990, 85%, that is 700 million people use solid fuels in India. And again, if you look at the map, it is mainly as a part of central and north India. In 2010, it came down to 60%, but the numbers remain the same. Still 700 million people tend to use solid fuel as a form of cooking. The reason is that it is easily available, it's cheap, and it is something that has become part of our culture as far as rural India is concerned. So it's actually estimated that 2.4 billion people in the world use wood, charcoal, animal dung or crop waste as a form of cooking. Combustion from coal is classified as a group 1 and biomass as group 2A carcinogen, and there is a strong association between coal smoke and lung cancer as far as data is concerned. A lot of people argue that wood is natural, so how can it hurt? And it's basically just carbon, hydrogen and oxygen, and it should lead to carbon dioxide and water, and therefore why should it cause such a lot of problem? But the reason is that the combustion efficiency is very, very low, and this leads to a large number of toxic substances, carbon monoxide, oxides of nitrogen, hydrocarbon, oxygenated organics, and other compounds being released as far as biomass is concerned. As a matter of fact, it has been calculated that a typical chula releases around 400 cigarettes per hour worth of smoke. And if you have a young woman who's cooking in a poorly ventilated kitchen, she's actually inhaling this much of smoke. And if you have a small child who's there with the mother in the same kitchen, in the early ages of his life, he is actually inhaling a very high level of indoor air pollution, which can lead to a number of effects as the child grows older. A number of carcinogens substances have been seen in the emission of combustion of wood and coal. PAH, there is sufficient evidence that it is present. Benzene, arsenic and nickel, and acetaldehyde and formaldehyde also has been shown to be present as far as biomass is concerned. There is now a strong body of data. A lot of work was done in PGI in the 70s and 80s and subsequently by the Chest Research Foundation, which has shown a strong association of biomass exposure in COPD. There are some data which suggest a link between lung cancer also, and wood smoke has been shown to increase the risk of lung cancer. This is a paper published in 2010 which looked at in-home coal and wood use and lung cancer risk. This is a pooled analysis of the International Lung Cancer Consortium, and this looked at 7 studies, and they actually looked at Asian data also and showed that wherever there was more of coal use, there was a significant high risk as far as lung cancer was concerned. The odds ratio was up to the tune of 5 in Asian studies where people were using coal or wood as far as cooking was concerned. So biomass consumption leads to increased number of carcinogenic constituents. Inhalation of these particles causes high concentration, leads to what is now known as lung overloading and sustained inflammation, and this causes release of reactive oxygen and DNA damage, leading to scarring of the lung and subsequently lung cancer. There is one paper from PGI by Dr. Behra who looked at again the risk of lung cancer in women who were not smoking and developed lung cancer, and they also showed that there was an odds ratio of almost 3.5 of women who are using biomass and developing lung cancer, and this is data basically from Punjab where biomass was being used as a form of cooking. A number of reviews have actually looked at this and shown that there is a strong link between air pollution and lung cancer, and that is another cause of concern. We are seeing a lot of non-smoking lung cancer occurring in our part of the world, and this is a cause. It's felt that this may have something to do with constant exposure to high levels of air pollution. We did a study long time back in 2004 where we looked at domestic cooking fuel and lung function, and interestingly showed that not only was lung function impaired, but in those women who were using kitchens which were better ventilated, the lung functions were better than those who were using kitchens where the ventilation was poor. So not only indoor exposure or biomass exposure, but the ventilation in the kitchen also plays a very important part as far as exposure and risk of COPD, decline in lung function and lung cancer is concerned. Moving on to outdoor air pollution. Where does outdoor air pollution come from? It comes from wood burning, it can be fireplace, chula, crop residual, which occurs as a part of crop burning in North India and Haryana and Punjab and causes a dense area of smoke in the Indo-Gangetic belt. It can occur because of burning of toxic substances like garbage or wood which is burnt during the winter months, air conditioning, refrigerators and fire extinguisher, fossil fuel burning, cars, boats, trains, and then it can be household products. All of this can lead to what is known as the air pollution picture, where from large areas you can get significant amount of outdoor air pollution. So air pollution can be stationary from power plants, from industrial combustion, biomass consumption, fossil fuel consumption, and it can be mobile, which occurs because of road transport, which causes also a major problem, especially now with increasing traffic and increasing number of vehicles. There's a big debate as to what is the percentage of each, and data tends to vary from different studies. Some data tends to suggest that transport is the major cause of air pollution, followed by fuel consumption, industrial process and others. But this data tends to vary from different sources. So I would really say that it depends on what data you're analyzing and how you're looking at it. But when we start looking at air pollutants, we have organic, inorganic and classic. The classics that are the oxides of nitrogen, ozone, the photochemical oxidants, particulate matter and sulfur dioxide. And then we have a large number of organic and inorganic substances which may be present in the air, which are causes of pollution. There is a lot of focus now on lead because it is so associated with neural development, and some studies suggest that lead exposure in children is actually leading to decrease in their intellectual development in our country. You can also have pollutants which are labeled as primary and secondary. Primary are which are produced by the source, and secondary are where when they come in contact with sunlight or with air, there is an interaction, and this leads to the so-called secondary pollutants like ozones and various other acids like sulfuric acid. The primary being oxides of nitrogen, sulfur dioxide, carbon monoxide and suspended particulate matter. Smog is basically a mixture of smoke, fog, air and other pollutants, and this is something we see very often in the winter months. We have two types of smog: the industrial smog, which is particulates of adsorbed sulfur dioxide and sulfuric acid aerosols, and we also have the photochemical smog, which is basically nitric oxide and gaseous hydrocarbons, which leads to production of ozone at a ground level, and this can also cause bronchial hyperreactivity and worsening of asthma. The focus has been on the PM 2.5, and PM actually is just particulate matter. You must understand that if you start looking at PM 10, and this gives you an idea of the size of PM 2.5 and PM 10 as compared to a human hair, and if you look at the human hair and its cross section, PM 10 and PM 2.5 are much less smaller than that, and that's why they can really reach to the alveoli and the small airways and cause significant degree of toxic effects. So any particulate size which is more than 10 microns usually do not penetrate the upper airways. Particulate size less than 10 microns gets deposited below the larynx, and 2.5 to 10 micron actually gets deposited in tracheobronchial tree. 0.1 to 2.5 usually gets carried to the lower airways, and we have now what is known as ultrafine particles, which is also present in air pollution, which is less than 0.1 microns, and these actually go into the alveoli, they get absorbed into the circulation and can lead to a hypercoagulable state and thrombosis. So particular PM 2.5, the short-term effects is it can lead to all-cause decrease in mortality, cardiovascular mortality, respiratory mortality, and increased hospital admissions. The long-term effects are basically again cardiopulmonary mortality, diabetes, lung cancer, and reproductive effects. PM1, like I said, which is much smaller, can also have a strong effect on blood coagulation and may be associated with thrombosis itself. There has been a major change as far as average PM 2.5 is concerned, and if you look at this change from 1990 to 2013, the countries in which this major change has occurred are India and China, where you can see these red areas. Bulk of increase in PM 2.5 has occurred in this part of the world, and if you start looking at the map of India, you see that again it's occurring predominantly in the Indo-Gangetic belt, where there has been more industrialization, and unfortunately this is what we call a landlocked area. So during times when industrial growth has occurred and in the winter months there's very little wind velocity, there is inversion which leads to air pollution staying at a very high level at the ground and leading to very, very high levels of exposure to individuals. This fine particulate matter contains a lot of adsorbed organic and absorbed toxic metals, and these go into the alveoli, they cause oxidative stress, they lead to inflammation, and this leads to increased risk of blood clotting and therefore leads to increased respiratory and cardiovascular morbidity and mortality. So ultrafine particles can actually get absorbed through the skin also, leading to and through the GI tract. It can also be inhaled, which leads to respiratory tract and lung injury. It can even go through the nasal cavity to the olfactory bulb and enter the circulation. And ocular exposure has now been also shown to affect the eyes and brain. A lot of PM 2.5 which goes into the lungs causes what we call oxidative stress. This has an effect on cardiovascular system, especially the endothelial cells, and leads to inflammation in the circulation, which actually leads to a significant degree of atherosclerosis and predisposes to cardiovascular morbidity and mortality. So the higher risk group tends to be infants and children, pregnant women, elderly, and those with underlying cardiorespiratory diseases. If you start looking at the adverse respiratory effects from air pollution, the short-term exposure actually causes exacerbation of asthma, exacerbation of COPD, bronchiolitis and other respiratory infections, and increased emergency room visits. As far as household air pollution is concerned, it can lead to increased incidence of pneumonia, increased risk of COPD, increased risk of lung cancer, impaired lung development in children, development of asthma, increased risk of chronic bronchitis, and data now suggests that it's a risk factor for increasing chances of developing pulmonary tuberculosis. So a large number of adverse effects have been linked to particulate matter, from premature deaths, lung cancer, COPD, chronic lung diseases, heart attacks, increased hospital admission, respiratory symptoms, decreased lung function, preterm birth, and low birth weight. We have this huge pyramid of effects of air pollution. The bottom shows a large number of our population, if you start looking at, have subnormal lung function, which is basically related to the fact that because of constant exposure to high levels of air pollution, the lung function tend to be low. We have individuals who have respiratory symptoms, increasing asthma attacks, increasing doctor visits, and then ultimately in some individuals it does lead to death. If you look at pregnancy and birth defects, there is a lot of data now, and especially data from a group from Chennai, which shows that low birth weight below the 10th percentile of the birth weight for a given gestational age and sex occurs. There is increased risk of intrauterine growth retardation for mothers who are exposed to PM10 levels of more than 40 or PM2.5 levels of more than 27 microgram per meter cube. Remember when I showed you the initial data, in India the exposure is to the tune of almost 100. So we are actually living, or our pregnant women are living through an area where exposure is almost 3 times what has been shown to be risky for them. And this is associated with intrauterine mortality, especially if there is exposure to nitrogen dioxide. Also, there is some data which suggests a higher risk if you are exposed to carbon monoxide during the second month of gestation. Exposure to ozone can lead to various valvular and heart diseases, and also can be associated with ventricular septal defects. This is a position paper which was published in the European Heart Journal, Advanced Journal, which was basically by a working group which looked at an expert position paper on air pollution and cardiovascular disease. And what they showed was that air pollution leads to oxidative stress and inflammation, leads to change, affects the atheroma, endothelium, platelets and heart rhythm, leading to plaque rupture, vasoconstriction, thrombosis and arrhythmia, and this leads to myocardial ischemia and infarction and heart failure and cardiovascular death. As a matter of fact, they stress that air pollution is as much a risk factor for developing coronary artery disease as is high blood pressure, high cholesterol, and this is something that we really don't look at, but a large number of our population which is living in areas of high levels of air pollution are actually more prone to cardiovascular morbidity and mortality because of the effects of air pollution. So high levels of air pollution can lead to ischemic heart disease, arrhythmia, venous thromboembolism, heart failure, stroke and peripheral artery disease, and it's something that we need to keep in mind. There are a large number of papers from the West which have tried to look at respiratory and heart disease mortality and air pollution. This paper actually looked at almost 43 million people in 29 European cities and found there was a 0.6% increase in daily all-cause cardiopulmonary mortality which was related to air pollution, and cities with a higher level of nitrogen dioxide exhibited larger association between change in PM concentration and mortality. A paper in the NEJM which looked at 50 million people in 20 large cities in the US and again showed that for each 10 microgram per meter cube increase in PM10 was associated with an increase of 0.21% and 0.31% of daily all-cause cardiopulmonary mortality respectively. And therefore, if you start looking at the data from our country, you'll find that this rise is much higher, because if you're looking at just a small rise of 10 microgram per meter cube in PM10, there is also data which suggests that even outdoor air pollution may, through various effects, cause carcinogenic effects and be associated with higher chance of lung cancer. This data actually looks at lung cancer, cardiopulmonary mortality and long-term exposure of fine particulate air pollution, published in JAMA in 2002, and again tends to show that environmental risk factors for cardiopulmonary and lung cancer mortality are higher in those individuals who are exposed to fine particulate air pollution for a long period of time. So I think there is a large body of data which tends to support this, that there is a definite link between high exposure to air pollution and cardiopulmonary morbidity and mortality and lung cancer. There is also data now emerging which shows that there is a high association of air pollution and allergenic potency of pollens. Acute and chronic exposure enhances air responsiveness to aeroallergens in atopic subjects, and this actually is because the pollutant can modify the morphology of antigen carrying agents and alter the antigenic potential. And also there has been a change as far as the pollen season is concerned. Because of global warming, now you have a longer time that exposure to allergens occur, and this actually leads to more chances of atopic dermatitis, allergic rhinitis and extrinsic asthma. The environment and which is associated with high levels of pollution and an individual susceptibility actually leads to higher chances of allergic diseases, and this has been shown in various studies also, that exposure to volatile compounds, pH, leads to increased oxidative stress, inflammation in the airways, and this actually predisposes an individual to develop allergic diseases like bronchial asthma. Now what about data from India? And there are large number of studies which have actually been done from Delhi. Studies have found that air pollution is associated with ADHD in children, it's associated with increase in all-cause mortality, increase in respiratory or associated with decreased respiratory function in children, increased respiratory problem for women and children, increased respiratory morbidity and hospitalization, respiratory illnesses, and also the data from our institute published by Dr. J.N. Pandey showed increased emergency room visits also for COPD, asthma and acute coronary events whenever levels of air pollution was higher. A recent paper which looked at the health risk assessment for transport corridor in Delhi through vehicular air pollution. This was done through mapping using geospatial mapping, and it looked at correlation of PM10, sulfur dioxide and nitrogen dioxide and the morbidity and mortality using air pollution model in 2015, and it actually showed that there was excess of 10,000 cardiovascular deaths and 10,000 respiratory deaths which could be actually linked to air pollution, and more than 2,92,000 or almost 3 lakh cardiovascular morbidity and respiratory morbidity could be linked to air pollution, and showed a direct relationship between the number of vehicles and mortality and morbidity cases in all sub-districts with large scale transport activities, and PM 2.5 was the most important parameter which correlated with excessive mortality. What are the effects which have been taken to actually mitigate this effect of air pollution? It's not that we're all sitting silently and doing nothing. We have developed what is known as Air Quality Index, which was developed by IIT Kanpur, which is basically a color-coded air quality index for India, and this has been now developed and being used in large number of cities. It's basically an important tool because it gives the public information and helps them to participate real time in how they can help themselves in getting away from the effects of air pollution, and this also helps policy makers in deciding what is to be done. We have this odd even car thing which comes on during the winter months as far as Delhi is concerned, and this looks at the Indian Air Quality Index looks at 5 chief pollutants: particulate matter, 10, PM 2.5, ozone, nitrogen dioxide and carbon monoxide, and giving a weighted average comes out with an index which gives you the air quality index. So we have good, satisfactory, moderate, poor, very poor and severe. Anything more than 400 means AQI is severe, and remember I showed you that in India in Delhi during the winter months it tends to be close more than 1,000 also. So the AQI actually helps individuals decide what they should do, and depending on whether it is good, satisfactory, poor, very poor or severe, it tells you what are the type of individuals that can be affected as far as air quality index is concerned. There has also been a number of efforts by the government trying to bring in various means. We have the Ujjwala Yojana by the Prime Minister, which is trying to get LPG into rural India, the odd even experiment in Delhi, and now there is an action plan to curb both indoor and outdoor air pollution. We have this smokeless chula and the giving LPG subsidies, trying to bring better quality fuel in rural India, but this has worked only partially to some extent. There is now a move to have LPG in rural India, and I hope this becomes a movement so that we can decrease the degree of indoor air pollution as far as rural India is concerned. Just briefly, the work that we're doing, this is a study that we've just concluded, which is looking at the effect of outdoor air pollution and acute respiratory symptoms in Delhi. This is a multi-centric study which looked at 5 centers in Delhi, and we did this from January of 2017 to February of 2019, and tried to look at association of acute respiratory symptoms in residents of Delhi with changes of outdoor air pollution quality. And we looked at 4 tertiary care hospitals in Delhi, and I'm just going to tell you the data from AIMS. We looked at PM 2.5, PM 10, nitrogen dioxide, sulfur dioxide, carbon monoxide and ozone, and looked at various weather variables to get an idea as to the correlation. Looked at daily percentage of patients with acute onset respiratory symptoms of less than 2 weeks coming to our emergency department, both the pediatric emergency and the adult emergency, and also looked at morbidity and mortality. We divided them into 3 clusters: those who had high levels of exposure to pollutants, moderate levels of pollutants, and low level of pollutants. And what we found was that when you start looking at areas, days when there is high levels of air pollution, the clusters with high exposure to high level of pollution tends to increase significantly as far as children is concerned, and this was actually associated with high hospital mortality. Similar data in adults, when we looked at adults also in these 3 clusters, we found that again in adults, those clusters which come with an exposure to areas where pollution levels are high and come with acute respiratory problems, the mortality tends to be much higher as to those which come with a low level of air pollution exposure. So this is a study where a large number of people were evaluated and screened in the emergency room of our hospital, and we showed that both in adults and children, both in terms of acute symptoms, cough, difficulty in breathing and nasal symptoms, there was a significant increase not only on that day but with a lag period of about 5 to 7 days as far as exposure related respiratory symptoms were concerned. The other study that we're doing is a multi-centric study which is known as Delhi Air Pollution and Health Effects, the DAPHNE study, which is being done with as a MRC DST trial with University of Edinburgh, Imperial College, Institute of Occupational Medicine, and a large number of institutes as far as India is concerned. And we're looking at 2 cohorts. One is the asthma cohort and the other is the mother and child cohort, and we're trying to follow them up. In the asthma cohort, we're looking at the adverse effect of air pollution in adolescents with persistent asthma and looking at their exercise tolerance also. A large number of biomarkers in the blood, urine are also being looked at, and exhaled breath is also being looked at. So here what we're doing is we're recruiting patients, doing their health assessment. We're using sensors which is known as air specs, so using sensors to look at exposure that they're having at school, in their home, by putting sensors in the school and also at the residential part. They also have a personal sensor which is collected through GPS, and the individual's exposure to air pollution. This was started off as a belt, but now it has become as a clip-on device, and in some individuals we are also doing exercise to see what the effect during days when pollution level is high, and exercise during days when pollution level is low. We are also trying to increase the awareness in individuals, and this is what we call a green school initiative, where we are going to various schools. We covered more than 30 schools and done more than 10,000 children, where we address the children and try and explain to them the problems of air pollution and how they can actually contribute to decreasing the effects of air pollution. This is a Delhi Public School, this is Sarvodaya Kanya Vidyalaya. We have done more than 30 schools and covered more than 10,000 children. We have a large body of data also because we've done lung function for all these children, and we are actually now in the process of analyzing that. All these children, we give them a booklet also as to what they can do to decrease their carbon footprint and actually bring down levels of air pollution at an individual level. So I think there is a need for everyone to get involved. So to conclude, environment changes are having a major impact on our health and wellness. It's what I called a silent epidemic and a silent killer, because it doesn't, you can say X individual died of dengue or he died of H1N1. It's very difficult to pinpoint and say that in the emergency such and such individual had lung cancer or had acute worsening of his COPD or cardiovascular morbidity and mortality because of air pollution. But both ambient air pollution and household air pollution have a major adverse effect on human health. Motor vehicles, industrial emission, construction are major contributors, and it has a major effect on pulmonary and cardiovascular health, which we actually don't give much importance to, and therefore I feel there is an urgent need for scientists, planners and policy makers to work together, because unless we do that, we're not going to find a solution to this problem, and our health and that of the next generation is at stake. Thank you very much.
Thank you so much, sir. If anybody has queries regarding this topic.
So the two most common question is role of air purifiers and wearing masks. So the role of air purifiers is not that strong. It's been shown that in some individuals who are more prone to asthma and allergic disorders, spending time in air purifiers may help. But one must understand that if you look at your 24-hour day, the time that you would spend in a sealed room with an air purifier is very little. You will still go out and be exposed to high levels of pollution. So the efficacy of air purifiers in the long term is not much. Since there is no other solution, people tend to use air purifier so that it may even give them little benefit. The same holds true for masks. You have N95 masks, we have 3-layer masks. The data to suggest improvement with masks is also limited. If people who are at high risk, elderly, young children or with cardiovascular or diseases go to areas where the pollution level is high, a mask may give them a mild degree of protection, but here again it has to be properly sealed. If you're breathing at a high respiratory rate, you will have air going in from the side of the mask, and that will carry pollutants into the lungs, so it's not something which is a total protection. I think we have to work on decreasing the source rather than looking at individual protection. So if you're using an air purifier, you have to look at the dimension of the office. The office has to be sealed. Most of our houses are not built in a way that they are sealed. You have air coming in, and if the door gets opened frequently, the air purifier efficiency actually falls. So the classical experiments which have been done to show the utility of air purifiers have been in a room which is well defined and it is totally sealed. So in a real life situation, the efficacy of air purifiers is not that much.
This is a high risk subset, those who are exposed to high levels of air pollution. You must have by now in Delhi. Is there any role of preventive vaccination, like just as in high risk elderly individuals and people who have high exposures?
Vaccination?
Will there be any place for that, for preventing?
So from my point of view, there is definitely a role. If you're asking about vaccination, no? So from my point of view, we always recommend that high risk people should be vaccinated. We have asked them to get the influenza vaccine on an annual basis and a pneumococcal vaccine. There is 2 pneumococcal vaccine, the PCV13 and the Pneumovac 23, the polysaccharide which covers 23. I recommend both of them 1 year apart, because PCV is a conjugate vaccine, it gives more immunity. Pneumococcal covers 23 serotypes, so it covers a wider range but it is less protective, and an annual influenza vaccine. If I may just add, the influenza vaccine now is available twice a year, because we used to get a pre-winter vaccine which was the northern hemisphere vaccine. After data that we did as a part of flu network surveillance, we showed that influenza actually occurs in our country in the tropics both during monsoon months and in the winter months. So the government actually then allowed us to introduce a southern hemisphere vaccine which comes somewhere in March, April, and therefore if you have an individual who comes to you pre-monsoon, you can vaccinate with the southern hemisphere vaccine, or if he comes during October, November, then the pre-winter vaccine which comes as a northern hemisphere vaccine, which then lasts for 1 year, and then you continue with that cycle for the next years.
Usually it was a masterly talk by you. I just want to know, any increase in the incidence of BPS you found because as an air pollutant and those places where did a study? Aspergillosis, any increase in the incidence of aspergillosis?
So, as far as aspergillosis is concerned, there are two issues. One is there an increase in allergic bronchopulmonary aspergillosis, that is aspergillosis causing an allergic phenomena. That data does suggest that like I showed, allergens including fungal allergens tend to be more because of the humidity and global warming. The spores of the fungus stay in the environment for a much longer period of time, leading to higher chances of allergy. Whether it is associated with more of invasive aspergillus infection, air pollution, I don't think we have enough data to that, but definitely leads to decreased susceptibility in the lungs, and data does show that there is a higher chance of pulmonary tuberculosis in people who live in areas where there is high levels of indoor and outdoor air pollution. But I don't think we have enough data as far as invasive aspergillosis is concerned. Thank you.